Speaking neurologically, the most important time for stroke patients after the stroke is as immediately as possible. Because when you plug in the context of rhythmic patterning and you plug in the context of that root in the brain, the melodic construct in sequence that is familiar, then we see quicker recovery. But in our study, we actually include caregivers, and they come to a choir. We call it a stroke choir, stroke caregiver choir, but it's run in the context of a music psychotherapy session in a community format. And the most important aspect of recovery in aphasia, we find neurologically, is repetition, and repetition paired with, in music psychotherapy, what we call a meaningful memory, a meaningful context. That's why we include the caregivers. They're called partners now, as part of the actual treatment. It's not enough to have just a person with Alzheimer's or with stroke come participate in a music moment. So what? How about when they go home? How about their husband or lover? We find, as music psychotherapists, treating in the context of trust, familiarity, embedded memory provides the quickest, most salient results.
There is some popular literature coming out right now, including videos of work that's happening in nursing homes with recorded music and headphones. And again, it taps into what I had mentioned before about familiar music tapping into autobiographical memory. So the difference between recorded music listening on headphones selected by, randomly, and music therapy is vast. The therapeutic implication of music to, spark response, that's the beginning, and that is happening. But I think we would move as music therapists is to look at the therapeutic process to give rise to a song list of meaning, a song list that has significant value and historical relevance to each individual, so that we're not using the same song list for A, B, C, D, and E, but rather each person has their own music of meaning, and that's significant to the work we're doing with both stroke and Alzheimer's.
And a song list per se is really fixed, so that you're plugging in perhaps to something fixed and static and used. When you unplug the headphones and you can frame the singing to the key the patient's singing in, when you can encapsulate that moment between couples, it's a much different, much deeper experience. And the studies show it's more meaningful, the live music therapy. Because you can plug in headphones and rock and be by yourself. And maybe that's meaningful neurologically, but it ain't so meaningful psychosocially.